So, autism is a neurodevelopmental disorder which begins in many children at around 18 months of age, or maybe even earlier in some children. It is a disorder which lasts lifelong and is characterized by impairment in communication skills, social skills, and the child will engage in repetitive behaviors. So, in today's live, I'm going to be discussing some signs of autism. Just going to wait for a couple of minutes. So, let's start the video. The first sign of autism is children with autism are very routine oriented. They love predictability and routine. They can be very resistant to small changes. They can be resistant to transitions. They might have struggled to transition from an activity to other activity, or maybe any kind of a change in their daily routines can throw them off. Number two is they might struggle with personal space. They might not understand the rules of personal space and they can struggle with it. They might go either too close to the people, so that's a difficulty for them. Number three, many children with autism, they have difficulty in communicating. They do not have a proper way to communicate, as a result of which they can have lots of anxiety and frustration. Number four, some children with autism, they do not like to be hugged. They do not like to be touched. They might be very hypersensitive to these changes, touching and hugging. Number four is they will show skills in one area, they will have advanced skills, whereas they might struggle in some other areas. So the skill development is very uneven in children with autism. So thank you for joining in. I'm speaking about some signs of autism. Do leave a comment and let me know where you're tuning in. So I'm just speaking about early signs of autism and some signs of autism in general. So we all know autism is a neurodevelopmental disorder which begins in children as young as 18 months of age. And it's a lifelong disorder, meaning it's not a disease which can be cured. So it's a lifelong disorder. Hello, thank you for joining in. So let's go to some early signs of autism first, and then we'll go to some other signs. So early signs of autism will be the child with autism is not giving you eye contact. They might struggle with play. They do not play with the toys in a traditional way. They might not engage in any play at all. They prefer to being alone. They do not like to be with people. If they have any speech, they might have regression of speech, or they might stop talking at all if they are already speaking. So we can see lots of regression. Some children with autism might toe walk due to lots of sensory issues. The other one is they might not recognize the immediate family members in their surroundings, in their environment. So that's an early sign as well. Not pointing. They might not point to the things. They might not have joint attention skills. So lots of signs which are the early signs of autism. So if you notice any of these signs, kindly do not wait. Make sure you go to a developmental pediatrician to get your child assessed for autism. Now let's speak about some other signs of autism. So the other signs are the child might engage in echolalia. Echolalia is just repetition of sounds or words they might have heard. Sometimes they might just repeat words from a TV show, or they might just repeat whatever you are saying. It can be immediate, they can say that right back, or in some cases, it can be delayed. Children with autism, some of them, they don't like to be hugged. they don't like to be touched. Some children with autism will line up the toys or they will line up the things. Again, these signs are not shown in all children, as autism is a spectrum disorder, meaning some signs will be seen in some children and some signs will be seen in some other children. The other thing is they are very resistant to change. Some of them are very resistant to change. They love predictability and routines. So any kind of change in their routines can throw them off. So do you have any questions? Kindly leave it in the comment. If you have any questions, or leave me a comment if you're a parent of a child on the spectrum. Were there any of these signs which I mentioned you noticed, or there were some other signs which you noticed in your child? Do leave a comment and let me know. The other thing is some children with autism are very rigid. They can be very rigid in what they eat. Many of them are picky eaters or selective eaters. Some of them might be very rigid with the clothing they wear, so, or the things they do. So some of them have lots of rigidity, and they also do engage in stimming behaviors, which of course is done for the purpose of self-regulation. It is not specific to autism. Stimming is something which we all do, but as neurotypicals, we know how to engage in the stimming behaviors in an appropriate way. But many children with autism will struggle with it. You will see them flapping their hands or looking at their fingers in front of their eyes or rocking back and forth. So you will notice a lot of stimming behaviors in children with autism. So does anybody have any questions before I end today's live? Do let me know. So if this is the first time you're tuning into my channel, just a little introduction. My name is Vidya Banerjee. I'm a mom to a 19-year-old son on the autism spectrum, and I love to help fellow parents of autism. I do it through my blog, through my podcast, and also through my social media. So do like this video, share it, and also make sure you subscribe to my channel so you can get more information to help your own child with autism without overwhelm. Thank you so much. I appreciate that. Thank you for subscribing, Samantha. I appreciate it. Are you a parent of a child on the spectrum? I'm also the host of the Autism Family Story podcast, which has over 100 episodes. It's a free resource for fellow parents of children with autism. You can hear it on any of your favorite podcast platforms, Spotify, Apple, or also my podcast is on YouTube. So you can definitely listen to it and get lots of helpful information. So thank you once again for joining the live today. I hope you find it useful. And if there's any topic, do let me know, which I can talk about in my future live. Thank you again.